I wanted to show you the intestinal permeability panel on the wheat Zoomer blood test, which also looks to see if you're on the celiac spectrum or have gluten sensitivity. So when it comes to intestinal permeability, it sort of progresses from bad to worse here, going down. So our gut is lined with one single layer of epithelial cells, and it's meant to open and close, kind of like the Panama Canal, letting in individual nutrients and amino acids into our bloodstream. But it's never meant to get stuck open. So the order is zonulin. So that's the tight junction in between the cells. Actin is intestinal permeability cutting straight through the cell, which should never happen. And LPS is the worst. Lipopolysaccharides are essentially like little drips of poison or infection constantly going into your bloodstream. The most common sources are chronic UTIs, sinus infections, lung infections, the mouth if you have swollen gums or pink spit when you floss, and often coming from the gut or diverticulitis pouches. Dr. Alessio Fasano says that gluten causes intestinal permeability for 30 minutes to 5 hours, depending on your genetic susceptibility. So LPS and gluten cause intestinal permeability, but we know in functional medicine that many other things cause it. Stress, medications, overexercise, nutrient deficiencies, food sensitivities. LPS increases gut-brain permeability, blood pressure, obesity, insulin resistance, diabetes, triglycerides, cholesterol, IBS, and possibly endometriosis. So how do we heal intestinal permeability? You can heal it through glutamine, butyrate, immunoglobulins, DGL, and colostrum, but also through removing the offending pathogens or infections, knocking back bacterial overgrowths, reducing physical and emotional stressors, and building up a thick, juicy mucosal barrier. That damaged mucus lining can be repaired through just eating a variety of colorful plants, mostly steamed or baked in the beginning, fermented foods, a moderate amount of healthy fats, proteins, and limiting caffeine and alcohol.